welcome to Mental Health Matters. My name is Barbara Meyers, and I'm the host of the show. On today's show, we're going to focus on mental health in the jails in Alameda County. It's been said that jails and prisons are emerging as the psychiatric hospitals of today. A recent U.S. Department of Justice statistics report states that 44% of people in jail have a mental health problem, and 76% have a substance abuse problem. Prison statistics are even higher. Clearly, there's a problem in the United States. So today, we will examine what's happening in Alameda County jails with regard to mental health. We're very pleased and honored to have two guests with us today to help and look at this program. I'd like to introduce Millie Swafford, who's the Director of Criminal Justice Mental Health Program, Conditional Release Program in Alameda County, and Tamara Childs, who is a Best Now trainee and the chair of the Pool of Champions Criminal Justice Committee. Millie, I'd like to ask you to give us some background about mental health in the jail system in Alameda County.
Okay, I'd be happy to do that, and thank you for inviting me. I'm always eager to talk about this topic because it's such an important issue in our county. As you said, there are a large number of folks in our jails and prisons with mental illnesses. It's estimated that about 16 to 18% of those have a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. And of those seriously mentally ill folks, about 85% of them have a co-occurring substance abuse disorder. So it's similar to what you were saying in terms of the statistics. There are a large number of folks in our jails and prisons with mental illnesses. So people wonder, why is this happening? What are the reasons for this? And if you look back in history, about 40 years ago, there was a change in the laws and our state hospitals began closing down. And that wasn't necessarily a bad thing, but the problem was that there was not a corresponding infusion of funds and services at the community level. And so over the last 4 decades or so, people have not had the kinds of resources and services that they need in the community to really do well and stay out of hospitals and to stay out of jails. So it's been a serious problem that's been growing, and because folks have not been able to get the treatment they need or the housing, they have often sort of ended up in situations where they are subject to arrest. An additional factor in terms of why people get arrested is that sometimes the symptoms of their mental illness are such that they get themselves in some sort of difficulty. It may be driven by their symptoms, and they're called to the attention of the police, and the police often don't have many options. They either can arrest the person and take them to jail, or they can take them to a psychiatric hospital. Often they go to the hospital 1 or 2 times, and then they are released, and then the police continue to see them, and they end up arresting them, and they end up in the criminal justice system.
Can you give some background about how many inmates we're talking about here in Alameda County?
Yes, the jail books 50,000 people into the jail a year. For instance, at Santa Rita Jail, which is our main jail run by our Sheriff's Department, there's 4,000 inmates there. And our North County Jail in Oakland, Glen Dyer Detention Facility, there's 600 inmates. Mm-hmm. And of all of those, the Mental Health Services sees about 900 people a month. So that's a lot.
Yeah.
And what we do is we screen individuals when they come in. So every person that's brought into the jail is screened by a medical nurse. Mm-hmm. And if they indicate that they have mental health conditions that need attention, they are referred to the mental health services for follow-up. And our mental health staff work actually in the booking section of the jail, which is intake. Mm-hmm. They work in a clinic area, and then they also work in the housing units where the inmates are housed. In terms of the staffing of our program, we have psychiatrists that work in the jail. We have 4 psychiatrists. We have about 16 mental health clinicians that see individuals, as I said, in various locations in the jail. We staff the jail 7 days a week for 2 shifts. We have a day shift and evening shift 7 days a week, and we are going to be soon starting 4 nights a week on a graveyard shift. So we've had to keep our staffing up because so many folks are coming into the jail that need to be assessed for mental health care when they come in.
Is it the case that the mental health facility that operates in the jail is the largest
in the county?
In the county?
Yes, it is. As I said, we see about 900 individuals a month. It's more than that are seen in the John George Psychiatric Pavilion, for example, which is our local acute and inpatient service. And it's larger than the clinics and the outpatient centers as well. So unfortunately, that is the case. Part of that is also because the law says that folks who do come into jail do need to be screened and do need to be treated if they have a mental illness. So our obligation is to deliver those services to those folks that do come in. And the jail also has accreditations that require that we provide these services. So that contributes to some extent to the high numbers because it's our responsibility to make sure that when folks come in, we do see them and assess them for mental health treatment needs.
So are the medications how are they dispersed? Is it by these clinicians that visit the...
What I can do maybe is just sort of run down what might happen to a person when they're booked into the jail that has the mental condition. First they're assessed and they're given an appointment, and they meet with a counselor, typically a therapist, and then also a psychiatrist. And so the psychiatrist will assess the individual, and if the person requires medications, those medications will be prescribed. There are nurses in the jail that then see the inmates on their housing units, and they have what's called pill call, where they distribute the medications to the individuals. We then have mental health staff that also follow up to see how they're doing on these medications, and they continue to be seen the entire time they're there just to make sure that if they need medications, they're getting them. If changes need to be made, that happens, and so on. Besides the medication services, we do have counselors there that work with inmates. We have crisis intervention in the jail because the jail is a very stressful environment, and people can have an experience of a crisis when they're there. They can also perhaps have suicidal feelings, and so we want to make sure that we do whatever we can to prevent suicide when folks are in our custody. We certainly monitor people while they're there, even if they refuse treatment, and folks do have a right to refuse treatment in the jail just as they do in the community, but we don't just decide not to see them. We will continue to try and engage them and monitor them to see how they're doing, and continue to make attempts to engage them in services.
Now, if they need acute care, do they go to John George Hospital or another?
Yes. What we're required to do is if someone is in the jail whose mental health needs exceed our capacity to care for them so that they are acutely mentally ill or acutely suicidal, we will send them out of the jail to a hospital. We use currently 2 different hospitals, John George Psychiatric Pavilion in Alameda County and also Santa Clara's inpatient unit. And they go there and they are treated for their condition and stabilized, and then they are returned back to the jail when they're able to return and be safely housed there. Throwing in at this point is planning to develop our own acute inpatient unit so that we don't have to send folks out to these other facilities, but we can treat them locally.
Can you tell us how you got interested in doing this kind of work in the jail?
I've worked for Alameda County for many years, 35 years, and 28 of those years I worked in the community, so I've had a long background in mental health as a psychiatric social worker and worked with people in the community with serious mental illnesses. I then, in 2001, accepted a supervisor's position in the conditional release program, which is a program for mentally disordered offenders that come out of state hospitals and return to the community. And I was really impressed with how well these folks were able to recover from their mental illness and also their criminal justice histories. And so that was very encouraging to me. I then was able to move into the director position for both the jail mental health services and the conditional release program. And it's been quite a heartwarming experience in the sense that there is so much need in the jail for these services, and sometimes people in the jail get mental health services where they wouldn't get them anywhere else. It's the only time they get treatment. And it's also an opportunity for folks who end up in our jails to actually get the attention they need and sometimes begin their process of recovery. And our hope is that when we do see them there, we can help them begin getting the care they need and then continue it when they go out of jail back to the community.
That's good. Yeah. So I'd like to talk with Tamara. Tamara, could you tell us something of your story? I understand that you had some experience many years ago.
Yeah.
And you were jailed.
That was about 20 years ago when I had my experience of being incarcerated. And at that time, when I spoke of having a mental illness, I was told that I looked normal, and I was given just a couple Tylenol just to make me sleep. I didn't get no type of service like there is now. Well, 20 years ago is a big gap between then and now. So it's a lot more things that are going on now.
You essentially got no treatment.
No, I received no treatment at all.
And then when were you eventually diagnosed with having a mental health problem?
I didn't get properly diagnosed until April of 2008 this year.
Oh, this year? Wow.
This year. So it was like about 15 years later.
Wow.
After being released.
Yeah. I mean, what kind of treatment have you gotten now that's helped you?
The treatment I receive now, I take medication on a regular basis, and I keep myself very active with the community. I go to quite a few talk groups, women's talk groups, and I stay pretty much active. I attend church on a regular Sunday basis.
Good.
And basically I just keep myself focused and keep my spirituality up, which is very healthy for me. And I just keep going.
That's good. What do you think helped you the most? What gave you hope? Because obviously you came from a very difficult time. And I was wondering what made the difference for you.
What made the difference for me was sometimes your family members can be your weakest and your strongest points. But then I found myself being with other people that had some mental, I would say, illness at that time. Just talking with people and being around people that I felt comfortable, that I felt of a place of like I was just normal. When before I didn't receive my diagnosis, I felt that I was alienated, which I did isolate myself around family, around friends. I stayed to myself a lot. I got involved with drugs, alcohol, and did numerous of things. And I always felt inside of me that I was better than that and I could change. And I fought myself for like 15 years going through this. I tried talking to family members, and it was, sometimes they would laugh and it would make me feel uncomfortable, so I just held a lot inside. And through the years, I just kept telling myself, you're a better person, you could do this, you could come out bigger and better than what you are. And it wasn't until years later that when I joined the Pool of Consumer Champions that I found there were other people that were not so much like me, but had they dealt with the same type of problems that I did. And I began going to meetings with them and attending women's work groups, and all of a sudden I started talking and couldn't stop. I just pretty much kept myself active and very busy and just trying to stay focused with, I wanted to make changes for myself and show my family that I wasn't like that. I'm better than what they seem to think I was. And
sounds like you're around supportive people. And
my supportive people came around those outside of my family.
Yeah, that's good.
It's hard to say, but it's, they were there, but not the way that I wanted them to be.
I understand that you're now in a training program called Just Now. And
Yes, I am.
Can you tell us a little bit about what that's preparing you for?
Well, Just Now is consumer-run operation, and it's training consumers that have a mental condition to be more active in society, in their community, and to get back into the workforce. And when I'm learning, I've only been there for a week, so it's all fairly new, but it's very very interesting. It's sometimes it gets to be very intense, but as a group, we all work together and we all participate, and we learn things about ourselves as well as learning other things about others.
Yeah.
So it's very interesting. I'm very excited, and I'm very happy that I was accepted.
You mentioned that the Pool of Champions has been very important for you in terms of having support, and I'd like to understand, what is the Criminal Justice Committee doing? I understand you're the chair.
Yes, I am. I'm proud to say that I am the chairperson of the Criminal Justice Committee. That committee was formed from the Pool of Consumer Champions. What the Pool of Consumer Champions Committee brings a strong consumer voice through advocacy and education to strengthen human rights, social inclusion, and quality of life for those with mental conditions. We have now completed two very important tasks. We have completed a policy and procedure. We have completed our mission statement, which I just read some from, and we are currently in the process of forming an African American Males Committee, but they do not discriminate against other ethnic groups. And I'm very proudly say that our committee is very happy to begin working with Millie Swafford and to bring mental health court to Alameda County.
Exactly what is a mental health court?
Oh, Millie?
Well, mental health courts, or behavioral health courts, which are sometimes called, are specialized courts that have been set up throughout the country. There's about 46 of them in California and probably about 150 throughout the country. They have been set up to specifically assist persons with mental illnesses that end up in the criminal justice system, to recognize that sometimes a person's mental illness contributes to why they get arrested, and they want to break the cycle of people getting rearrested and returning to jail. So there's a special court team that's made up of a judge, district attorney, public defender, and mental health staff that all work together in the interest of finding treatment for the individual in the community and supporting that treatment, with the goal of breaking that cycle, as well as preventing that person from returning to jail.
What kind of explorations are underway about possibly having one in Alameda County?
Well, currently there is a process going on in which our court system, as well as our behavioral health care department, is seriously considering developing a behavioral health court for Alameda County. Our Director of Behavioral Health Care Services, Dr. Mary Thomas, is visiting some of the surrounding counties that have these types of courts. She will be meeting with some of the court representatives, some judges, and also the district attorney and public defender's offices to begin determining how this will really be developed in our county. So we're very hopeful that this will happen in this county. I think it's a really good practice for folks that end up in the criminal justice system that have mental illnesses.
And how's your committee helping with
Helping
this?
Millie?
Yeah.
We're visiting mental health courts.
You're going along with some of these visits that are happening?
Well, I haven't went along with Millie as of yet. I would like to. Maybe in the future I will. But I have visited the one in Santa Clara County, which is with Judge Manley. And tomorrow I will be with Dr. Mary Thomas, visiting the mental health courts in San Francisco.
Good. Very good. Sounds really positive. I wanted to ask you both, how can friends and family support those who are in jail and possibly have a loved one who's in jail and mentally ill? What have you seen that's worked in terms of family and friend support?
Well, I've seen from family and as well as friends is when someone has a cry for help is to be there for them, to listen to them. You don't have to give them feedback all the time, but sometimes, most importantly, it's when someone's listening to you and you have the undivided attention, especially eye contact is very important, is you get a good feedback. You get the feeling that someone's there for you. You get a feeling that they are there for you and that they are listening, that they do care for you and they love you.
That's good.
Well, yeah, I certainly agree and support what Tamara is saying. I think families should stay in contact with their relative when they're in jail. They can visit at the jail. They can contact the mental health staff that work in the jail. We also have a court advocacy project now where we have some mental health staff in the courtrooms to help persons that come into the various courtrooms throughout Alameda County. The family members can contact those representatives. There's also a inmate locator link on the Alameda County's website so that they could find out. For instance, sometimes people don't know that their relative is in jail. They don't know where they are, but they don't know that they're in jail, and they can actually access this and type in the person's name, and it'll tell whether this person's in jail or not. And we're soon going to be hopefully developing a link on another website, probably behavioral health care, and the sheriff's website, so that family members can give us information, but as well have access to understanding what's happening to their relative. And of course, this will be with the individual's permission. We can't disclose information to families because of confidentiality, but we can certainly receive and hear from them in terms of what their concerns are and whatever information they might think would be helpful for us to know to help their relative while he or she is in jail.
I'd like to know what you think about crisis intervention training, or CIT. It's training for the police so they understand how to handle mentally ill offenders.
I would definitely like to see all police jurisdictions trained in CIT, as well as sheriff's deputy staff who work in the jail. Basically what it does is it trains law enforcement officers in understanding mental illness, understanding the symptoms of mental illness, understanding how to work collaboratively with mental health staff to intervene when they are called to deal with a mentally ill individual, so that the crisis is resolved in such a way that there's a limited, if any, use of force, and there's a sort of peaceful resolution. I think there have been some instances where a mentally ill individual has been actually harmed because the situation escalated. And so I think the teaming up of mental health staff and police officers around interacting with mentally ill individuals in the community so that this doesn't happen is really an important thing.
I know there are some support groups for outgoing inmates. Have either of you had any experience with those or know of some support groups?
One is New Dynamics and Hope Project.
And
that's with one of my committee members, David Buckingham. And then they have one at Piers for Women, a women's group at Piers.
Okay. I'd like to ask you both, what would an ideal future look like with respect to mental health in jail?
If everything works fine, as far as if mental health courts were here?
Yeah,
I
that's
think
part of
the
it.
crime rate in would be a great reduction. And as far as the jail goes, that's a hard question to answer because the laws change so much for people that go back in and that go in and out of prison or jail per se. And it can depend on what type of crime they've committed and what type of mental illness they do have.
I know when we talked about this before, we talked about early intervention so that the person wouldn't go to jail to begin with and their mental health problem would be taken care of. And then having the full array of services for inmates, and then also a connection with the community and so forth so that they go out.
I think an ideal system would certainly involve early intervention and prevention, as you mentioned, in the community, so that hopefully it doesn't ever get to the point where a person's mental illnesses and substance abuse problems are so extreme that they end up getting arrested because of it. So I think a lot of treatment early on would be good. Certainly the crisis intervention treatment for, training for police officers would be an ideal. Resources for pre-arrest diversion. Police officers don't have a lot of alternatives when they come across someone. They either can take them to jail or the hospital. There aren't a lot of other resources for diversion. And also post-arrest diversion. Once someone is in jail, finding ways to get them into other services in the community rather than keeping them in jail. And sometimes we just don't have it.
I'd like to give you some resources and organizations on your screen. First, the Bazelon Center for Mental Health Law. That's sort of the premier mental health and law organization. There's the NAMI, National Alliance on Mental Illness, has a guide for mental illness in the criminal justice system, which is online, which is wonderful. There is Millie, of course, who's the Director of Criminal Justice and Conditional Release Program. There's a court advocacy project that she mentioned for advocating for people who are in jail. Then there's the pool of consumer champions that we heard about in the Criminal Justice Committee. There's mentoring programs that are available to some people. Those resources you can see on your screen. And then if any of you are interested in Best Now training program for peer specialists, that's the program that Tamara is in. That's available too. I'd like to thank you, Millie and Tamara, for being guests on the show. And for closing words, these are the words of Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you, and I'll see you next time.